Hi everyone, I'm Dr. Jason Smith. Today I want to ask you a few questions about your breathing and talk to you about brain oxygenation and tell you about a simple, inexpensive device that you can use to help you find out your oxygen saturation baseline. So here are the few questions. Do you or your loved ones have any health conditions that affect your ability to breathe easily, such as sleep apnea? Are you sensitive to air pollution? Do you have asthma or seasonal allergies? If you have allergies, you know that it can cause tissues in the nasal passages and lungs to become irritated and can result in bronchitis, chronic coughing, and shortness of breath. You probably already know this, but proper oxygenation affects every tissue and function in your body, especially your immune health, your brain, and your gut. Just because you breathe doesn't mean your body and brain get enough oxygen. Many factors such as anemia, blood sugar disorder, smoking, sedentary lifestyle, and chronic stress all can decrease your oxygen levels. With the recent pandemic, more people are hearing about a condition that physicians are calling silent hypoxia, which is basically like a form of oxygen deprivation that's difficult to detect from just observing the patient. As you've no doubt heard, this can progress into one of the most serious and life-threatening complications called COVID-19 pneumonia. Now, patients with this type of pneumonia have to be put on a ventilator, and once this happens, the chances of a good outcome drop considerably. What's more, many COVID-19 patients with pneumonia don't even initially experience any breathing problems or signs of hypoxia, such as low tissue oxygen levels, even though their chest x-rays show diffuse pneumonia and their oxygen saturation levels are well below normal. So, in case you didn't know, normal oxygen saturation at sea level is between 94 and 100%. For COVID-19 patients, it can get down as low as 50%. According to Dr. Richard Levitan, a physician with 30 years of emergency medicine experience, he says, a vast majority of COVID pneumonia patients I met had remarkably low oxygen saturations at triage, seemingly incompatible with life. But they were basically on their cell phones as we put them on their monitors. They were breathing fast, and they had relatively minimal apparent distress despite dangerously low oxygen levels and terrible pneumonia on chest x-rays. So this presents a huge problem. By the time these patients arrive at the ER, their pneumonia already has progressed to the point where they'll require a ventilator. Now, once you're on a ventilator, the odds of survival have severely dropped. Even if the patient does survive, the odds are so high that they'll suffer from lifelong health problems from being on the ventilator for so long and having so much inflammation in their lungs. A lot of times the little air pockets will collapse. The little alveoli will collapse in their lungs. But what if there was a way to detect low oxygen levels in pneumonia much earlier so that a patient could seek help before a ventilator becomes necessary? Turns out there is. It's called a pulse oximeter. Brought one from my office right here. A pulse oximeter is basically a simple device that you place on your fingertip, press a button, and it uses a red and infrared light to determine and calculate your oxygen saturation level along with your pulse rate. And, according to the Mayo Clinic, a normal pulse oximeter readings are from 95 to 100%. That took about 10 seconds, maybe less, to show that mine right now is my pulse is 73 and my oxygen saturation is 96%. So in this New York Times article that I'm referencing, Dr. Levitan said that some patients had oxygen saturations as low as 50% and were breathing fairly rapidly, but they were talking on the phone and still weren't in distress. So I've been using pulse oximeters in the routine evaluation of all the new patients in my clinic for the past 12 years. And what I found is that people who don't seem to be recovering well from brain injuries or spine injuries or even just have chronic pain usually have less than optimal oxygen levels. And I find that these same patients usually have a breathing pattern called paradoxical breathing. And with a healthy breathing pattern, when you inhale, the abdomen and the chest expand as the diaphragm contracts and move downward. But with paradoxical breathing, that pattern's reversed, which means that when you breathe in, the abdomen and chest contract and then during expiration it expands. So that's basically backwards. It takes a lot more effort. And this is usually caused from a weaker inhibited diaphragm or just from restrictions due to poor posture, tight muscles, or chronic pain. Now, even long after an injury, which is usually what triggers it, this breathing pattern can just persist and cause a vicious cycle. So the lack of movement in the rib cage decreases necessary feedback to the brain, and that basically causes your neck muscles to tense up, and then they lift the ribs from above to compensate for a weak diaphragm. And then this causes more shallow breathing and a rapid breathing pace, and then eventually less oxygen delivered to the brain and tissues, etc. So if you're experiencing any mild breathing symptoms or any of the top 3 symptoms of COVID-19 that we talked about last week, if you remember, loss of smell or loss of taste, cough or fever, then measuring your oxygen levels with a pulse oximeter like this one twice a day could help you detect hypoxia and signs of pneumonia much sooner than you'd otherwise be able to. Then you'll be able to know what your baseline levels are, and you can make an informed decision to seek care if your level suddenly drops 10 or 20 points below your normal. I personally have a pulse oximeter at home, and I'd suggest you pick one up as well. It just comes in handy. And you may want to have your rib expansion measured as well. We could talk more about that later, and I've been doing rib expansion measurements before and after my adjustments for probably at least the last 10 years. Now, as far as the pulse oximeters are concerned, which one should you buy? Well, in the attached email, I included a review of the 10 best devices on the market this past year. A few months ago, when I was buying some new ones for the office, they were around $20, and now they're jumping up to the price of about, I couldn't find any less than $40. They're average $50 to $60. So thank you for watching today. I have a challenge for you. Number 1, get your baseline oxygen saturation level so you know what that is. And also, I challenge you to start doing some breathing meditation every day to decrease your stress levels and get in the habit. I want you to do it just as faithfully every day as you brush your teeth. So just consider it part of your daily brain hygiene routine. Just start with a couple minutes a day, and then work up to 10 to 20 minutes once you get in the habit and you really want to reap the benefits of relaxation and better oxygenation to your brain. So I hope this information helps keep you and your loved ones healthy and safe. And I really encourage you to keep learning and forming good habits to care for your brain, because it's the only one you have. Oh, and keep an eye out for next week's video, where I will reveal the single most important thing you must do to have a strong and resilient immune system. And just so you know, it's not taking a pill or taking any medication. So, look forward to talking to you next week. See you then.